Hello. So this is Cowie. So first we're going to do is start the APGAR. So we want to start the skin. The skin right now is pretty white. So I'm going to give that a 0. The heart rate, I'm going to listen to it. Give the apical heart rate. It's going to be greater than 100. So it's going to be given 2. Then I'm going to watch for breathing. So the chest is rising. And you can't hear him, but Cowie is actually crying too. So he's going to have a 2. Then you look for muscle rigidity. It's very flaccid. Very flaccid. So it's going to be 0. And then grimacing. So I'm going to be touching him everywhere, trying to get a reaction out of him. There's no reaction at all, so that's also going to be 0. The crying was high pitched. The skin color, once again, was white. Check for lanugo. You want to check for milia, which there's no white bumps. It's also kind of hard to see because he's white. You want to check for vernix costia, and then the pigmentation. So the pigmentation obviously is very low. It's going to be very light. For the head, you want to check for sutures. You want to check for the fontanelles, so the anterior and posterior. You also want to check for molding. So for a lot of pregnancies, molding can occur. Cow just has an odd face because he's an actual cow. So he does not have molding. And he has really good head control. So see that his neck is holding his head really well. It's not just flopping all over the place. He's holding it really well, so it's good head control. The eyes, it's hard to see, but the eyes are somewhat in the right place. There's no pupils. There's no sclera. And the conjunctiva, it's kind of hard to see as well. So it's very limited conjunctiva. For the ears, they're a little higher placed up. They are round. And Cowie did not pass the hearing test because he cannot hear me. So for the nose is right here. It's pretty good placement. But the patency is not really patent. You know, the nostrils aren't really patent. So for the mucus, or for the mouth, you want to check the lips and the gums. I'm going to say the lips and gums are pretty good. They're pink and moist. Mucous membrane, I'm going to say dry just because I can't get to the mouth. And then you want to worry about the frenulum. The frenulum is right underneath the tongue. So it's going to be intact. It's going to be right placement. It's going to be intact. For the neck, the position's normal. You know, it's pretty good placement. The trachea is normal. And then the clavicles are also going to be normal. It's going to be like right over here. For the chest, the shape is pretty round. Circumference is very round as well. See if you could see that. It's very round. Circumference is pretty large. No nipples, no breast buds. So I did listen to heart sounds, and heart sounds S1 and S2 were heard, no murmurs or bruits. The abdomen, it's round, soft. Active bowel sounds, once again, very large circumference. It's a pretty big dude. And then for the umbilical cord, if it's brand new, it's going to be shiny and yellow. And if it's going to be older, it's going to be more brown, purplish, bluish color. So checking for the genitalia, he is a male. You can't see it, but he has a scrotum and testes. And then you want to look at the genitalia. So the urinary meatus, urinary meatus, it's going to be right where the urine comes out. So it's going to be proper. It's not going to be below or above anything. It's right where it needs to be. The output I recorded was less than 30 milliliters, and there was no discharge anywhere. So for the extremities, you want to measure the length. I think it's pretty good. The length is pretty good. You want to measure the movement. So the movement, once again, it's really flaccid. He doesn't flex at all. So it's very flaccid. He has no fingers or toes. That could be an issue, but we'll get there when the time comes. His hips are very bulgy. His hips are very wide. And his pulses are even bilaterally. So check the pedal pulses. Check the radial pulse. They're even. Both sides bilateral. So now it's time to check for the back. It's round. It's actually flatter than the stomach. And you could actually see the little indentation right there. So that's where his spinal column is. And then he does not have an anus. does not have an anus, so is not patent. So for the reflexes, the rooting, you want to stick the finger or the object you want to be putting in their mouth right next to the corner of their mouth. And then if, obviously they'll kind of root around, put their mouth around that object. And then that's where the sucking comes in. So the sucking now is for the sucking reflex. You use that a lot for breastfeeding. So for the palmar grasp, it's going to be very hard. It's going to be negative for him because he doesn't have fingers. But you put your finger right in the palm, and then hopefully their hand kind of curls around your finger. For the plantar, it's very similar. You want the foot to be kind of curled around, the toes want to curl around your foot, your finger. That's negative. For the Babinski, you want the toes to fan out. So you want to go from the heel kind of to the toes to like the ball of the foot, and then you'll see the toes kind of fan out a little bit. For the Moro, we're going to try right here. Going to drop him. As you can see, he kind of widened his stance, kind of protected himself. The mole reflex was a good check. And then for the tonic neck, which is going to move his head to one side, and then that side that the head is moving, it's going to outstretch, and then this one's going to come in. Kind of looks like he's fencing. He's going to be a negative for that one. So now I'm going to do the vital signs. I did his temperature. It's 98 degrees Fahrenheit. The pulse, I'll listen to it again because you want to be sure for the vital signs. You want to listen to the apical pulse. And I'm not going to go to full minute, but it's going to be 105 for the apical pulse. And then from there, I'm also going to listen to the respirations. So I found that it was 35 respirations, very easy, no issue with breathing, no wheezing. And then for the nutrition. So the nutrition, you want to ask about breastfeeding, if the baby is breastfeeding. And then if so, you want to make sure that the parents know that it's about what side they do it on and how long they do it for. So if I remember correctly, it's 20 to 45 minutes for breastfeeding. And then obviously you want to interchange between left and right breast. And then finally for bottle feeding, you really just want to, I forgot the ounces, but I believe it's like 2 to 3 or 1.5 to 3 ounces every 2 to 3 hours, I think. So you want to just monitor how much intake they're doing right there as well. And then finally for the education. So you obviously want to tell the patients that they need to come in for routine checkups, not just for the baby, but for the mom as well. You also want to promote skin-to-skin contact. It's very important, to develop a relationship, mother and offspring vibe. So, and then finally you want to keep going with the sound of their voice. So the mother just wants to continuously talk to the baby. The baby will then recognize her voice. The baby loves to look at different things. So the baby will look at the mother's face, at the father's face, and whoever's holding the baby, I imagine they'll keep looking at that direction. And then when they're home, you kind of want to promote tummy time. So you want to promote the tummy time, 1 to 5 minutes, a few times per day. So tummy time is when you put them on their stomach and they kind of just look around, look up around, just do whatever they'll do. And that promotes the head, neck, I think body in general, head, neck, and body strength all together. And then finally, you really do want to emphasize the routine checkups. As much as you think that they're going to be out and gone, you want to make sure that they have contact with a pediatrician, contact with a regular OB doctor to make sure everything's okay, because you want to get those vaccines together. You want to do everything like that. All right. Well, thank you. This is Cowie.